Public perception of physical therapy often stalls at basic massage. The clinical reality requires real-time biomechanical analysis, neurological rehabilitation, and precise interpretation of diagnostic imaging. Chulalongkorn University's Department of Physical Therapy, housed within the Faculty of Allied Health Sciences, engineers this modern practitioner. Their 2023 revised curriculum operates as a strict architectural blueprint. It requires exactly 139 credits to construct a specialized, autonomous healthcare professional. The core mandate driving this build is evidence-based practice. Students must integrate peer-reviewed research, objective data, and medical technology into every patient intervention. To achieve this standard, the program rejects ad hoc learning. Every course acts as a load-bearing wall for the next, following a rigid chronological scaffolding. Mapping this specific curriculum structure reveals exactly how a novice is safely transformed into an independent medical expert. The sequence begins on campus, where clinical practice is deferred in favor of pure scientific bedrock. Year 1 establishes the molecular foundation. Students complete rigorous requirements in general chemistry and physics to understand the physical laws governing human tissues. This micro-level understanding immediately scales to macroscopic structures. Through Gross Anatomy 1 and 2, students map the precise architecture of the human body. Year 2 shifts to applied mechanics. Courses like human biomechanics and neuroanatomy teach students how the physical structures they memorized actually generate and control movement. Before any treatment technique is introduced, students face a critical bottleneck: assessment and diagnosis. They must prove they can accurately identify a pathology before they are permitted to address it. Without this rigid sequence of scientific bedrock, any physical intervention attempted later in the clinic would be dangerous guesswork. By year 3, the curriculum utilizes a systems approach to compartmentalize the overwhelming complexity of the human body into masterable clinical tracks. Looking at the Year 3 study plan, we see the heaviest clinical tracks. Students undergo intensive training in physical therapy for the musculoskeletal and nervous systems. The primary physiological systems are completed with coursework in cardiovascular and respiratory physical therapy. Mastering the baseline systems is a prerequisite. The curriculum then forces students to adapt these principles to highly specialized demographics. The mechanical and physiological variables change drastically depending on the patient. Students must study and modify their protocols specifically for pediatrics, women's health, and geriatrics. At the end of the 3rd year, the student understands every major component and variation of the human machine, but they have yet to operate it in the unpredictable real world. Year 4 forces a shift from the controlled environment of the classroom to the high-stakes reality of full-time clinical practice. Students enter a grueling progression of practicum courses, navigating practice in physical therapy 1 through 5. This official study plan demonstrates how these practicums escalate. What begins as supervised tasks quickly ramps up to massive 15-hour clinical loads, demanding complex, full-time autonomy from the student. Alongside treating patients, students face the highest-level layer of the curriculum, the generation of new research. The course descriptions for the final capstones specify their purpose. Students must formulate original research questions and systematically process the application of evidence in clinical settings. This research mandate functions as a final filter. It ensures that graduates possess the skills to generate new medical evidence, rather than simply following established protocols. The university audits the success of this build using a strict set of expected learning outcomes. This official table maps the curriculum's design to its results. The foundational sciences of years 1 and 2 map directly to ELO 1. The heavy clinical and research mandates of Year 4 align with ELO 2, requiring safe interventions based strictly on evidence-based practice. Running quietly in the background for all 4 years is the requirement for professionalism, ethics, and leadership, ensuring clinical skills are paired with clinical responsibility. The student executes a continuous chronological journey from memorizing basic cellular biology to safely managing complex neurological rehabilitation on the clinic floor. The BSc in Physical Therapy at Chulalongkorn University is a meticulously engineered pathway designed to produce autonomous, evidence-driven healthcare experts.